Hi, my name is Carlos St. Just, licensed acupuncturist, holistic healthcare provider, and that's not an official title. I'm actually a licensed acupuncturist, but I like to emphasize that second portion because really that's what we do. We are in the integrative aspect of medicine, right? Combining two different systems, which is biomedicine and traditional Chinese medicine. I've been in practice for 8 years, going on 9 years now, and I've worked with a wide variety of patients, everything from private insurance, Blue Cross, Blue Shield, Kaiser, to the workers' comp system, and just patients who what we call cash patients, so patients who are just out and seeking care, right, outside of a regulatory system or something like that, right. With this, I just wanted to, and I have some talking points here, point out that the coronavirus is not a hoax, right? If anything, I always say we want to follow the basics, right? If a patient comes in, I want to know if they've seen their primary care doctor, if they have labs, if they've done imaging, x-rays, right, things of that nature. So it helps, right? Right, we put it all together, right? It's not like a lot of people think when you come from the integrative or holistic side, there's no science behind it or whatever the case may be. That's not the case, right? If anything, we use what we have and then we build on top of it. So in terms of following guidelines, we do want to wash our hands, right? According to CDC, right? And hospitals and healthcare providers. We do want to wash our hands. We do want to stay our distance. We do want to quarantine ourselves if we're feeling sick. We do want to stay out of the public if we are in the affected age group, right? Most definitely, right? Avoiding large crowds, things of that nature. We want to make sure that we are covering all of those things. Disinfecting surfaces, right? With, whatever is recommended, bleach, alcohol. I'm working on a spray here, which I'll talk about later here. It's based on a couple essential oils that I have used personally, and I have researched, right, which have science validity in terms of being able to deal with bacteria, viruses, and fungi, right? So, excuse me. So with that. So TCM is used a little bit differently in China, right, as opposed to here in the United States, right? I work in a private practice, and I see patients, and I get referrals, right, from other clinics, right, and so it's not as integrated in the hospitals, whereas in China, right, they're utilizing both biomedicine and traditional Chinese medicine in order to treat patients, right? There is no cure for COVID-19, right, as to date. This is March 15th, here on a Sunday, lovely Sunday, right? I love working on Sundays, right? And seeing patients, right? I love, when you love what you do, right, it's always, every day is a blessing, right? So, with that, I want to just give you some assurance that, there is no guarantee, right? But according to CDC guidelines, we're supposed to treat the symptoms. And that's where traditional Chinese medicine, I really do believe, has a place, right? And has been shown in all the cases that have been treated and used in China to be effective in treating, like, the symptoms of the coronavirus, right? Of this influenza, right? So just putting it out there, and it's not like, it's more complicated, right? This video is just to get you to think and give you some reassurance and tell you not to panic and prepare yourself. Even the CDC guidelines state to work on your mood, right? And to continue doing things, meditation, yoga, Tai Chi. One of the best times to work on that lung system, right? Because the lungs are going to be attacked. there's a lot of validity in what's out there. Now, I do understand, like, for instance, with this spray, there is no research on this virus. But, one of the things is that, there is research, literature on, on past viruses and bacteria, right? So, what I'm creating here is trying to I'm trying to make something that is effective, that you can use as a disinfectant, and you can also use as, as an aerosol, right? So, if anything, if you look at the cruise ships, the infection rate was high because of being in small areas and the air filtration and things of that nature. Well, what if we have something that can help to reduce the risk of attracting of a virus or something like that, of having an aerosol antimicrobial. You spray Lysol, you can't breathe Lysol. You can't breathe in bleach. You can't drink bleach. But something that is made of 70% alcohol, right, and mixed in with the other essential oils such as tea tree oil and oil of oregano and fruit seed extract. Those are the ones that I've researched, and I got a couple others, eucalyptus oil as well. So, just putting things out there. Once again, this is not a valid, way of treating coronavirus, right, or stopping coronavirus. I'm just giving you my insight in what I'm using, right, and based on the research that I've done. So I hope that helps. If you have any questions, please feel free to send me an email at mailbox at the mailbox at csjacupuncture.com. You can also send me an email at mailbox at themindbodydude.com. That's a whole nother thing. Or you can send me a message on Facebook. That's A-OK. Wishing you all the best and more to come. Thank you.